The NHS is changing at a pace that it's never done before. It has to make the savings, and so really trying to do my job on less resources but it's expected to deliver more is really difficult. I think it's about trying to do collaborations. So for example, we've just gone out to procure an electronic document management solution, and we've joined in forces with other trusts to try and save money and working together collaboratively. It's about being innovative, making the most of what you've got, and being pragmatic, accepting that you can't deliver the perfect solution, but at least try and move forward. If the NHS is to survive and make sure it balances the books, we've got to work collaboratively to deliver integrated patient care, and that's not just with our other healthcare organisations such as GPs or mental health trusts and hospitals. It's also about working closely with local authorities and social care as well. So we're not going to have any choice, we're going to have to find a way to work together. My hospital has been very paper-based and the nurses are not used to using IT. The first system we've given them is e-prescribing. It's very scary when you're not used to computers. Within a couple of days they absolutely love it. We know for a fact that it's saving on average 15 minutes per nurse per drug round, which is phenomenal. So they can see a benefit in terms of the time saving, a lot less likely to make mistakes because they can read it. It's not trying to understand what a doctor scrawled, and it cuts down on the errors. So things like that have a huge impact for patient safety, and it gives the nurses more time spent with the patients as well, which has to be a good thing. The NHS as a whole is very resistant to change. It's risk averse. It's the nature of the beast because of, if you make mistakes, it can have terrible implications for patients. So it's very difficult. One of the key things you do is got to get clinical engagement. I think it's about trying to make things easy for clinicians so that when they want to access things, they're available when they need it. They're available to be there quickly, and they're not weighted. So all these things need to be done in the round. So the key thing is, even when we're doing things like we're developing our self-service apps so that clinicians can go on and say, I want a new PC or I want a new piece of software, what the important thing is that they've been involved in the design of it and the testing of it all along.